Hi, my name is Anika Majaria and you're watching Dubai Live TV. Today we are at the American Hospital and sitting with me here is Dr. Nazakat Hussain, Clinical Director of Rehabilitation Medicine and Spinal Cord Injury. Hi Dr. Hussain. Could you talk to me about your speciality?
As a Clinical Director of Rehabilitation Medicine, my role is to establish and maintain high quality multidisciplinary services for rehab medicine. It deals with getting people after acute injury or after an acute event back to their feet and try to maximize their potential and maximize their participation in the community.
What types of patients do you typically work with?
Mostly we deal with neurospinal conditions, which involves like stroke patients, somebody having a cerebrovascular accident, which is commonly called a stroke, after traumatic brain injuries, which can happen after car accidents or falls from high-rise buildings or industrial accidents. And we also deal a lot with cancer patients, other neurological conditions like multiple sclerosis, musculoskeletal conditions like people having multiple trauma after recovering in the acute setting. They need a lot of input from physiotherapy, occupational therapy and other disciplines to get back to their normal life. We also deal with post-operative orthopedic hip and knee joint replacements as well.
What types of treatments are typically available for these types of patients, and do these patients fully recover?
The physiotherapist's job usually is to do mostly with the mobility of the patient, while the occupational therapist helps them to try to recover back and learn back again the activities of daily living, which includes personal grooming, dressing, washing, and household and office activities, etc. At the same time, we also have very specialist speech and language pathologists, because many people with after stroke or severe brain injuries are not able to actually speak properly or swallow properly. Similarly, we have medical and surgical treatment for spasticity related issues, which is quite common after neurological conditions. We also provide a range of care for pressure ulcer treatment, which is again a common condition which people can develop pressure ulcers after neurological problems.
What are some of the biggest challenges that you face in this field?
I think the biggest challenge I would say is person or individual and families' expectations, because many people expect that they will recover very quickly and fully back to what they were before their injury or an acute event, which unfortunately it's not true. Especially the nervous tissue, which is the brain and the spinal cord are made of, they take much longer to heal or to recover. And a lot of time they cannot recover completely, and people have to learn the new skills, and it takes time. So that's probably the biggest challenge.
Would you be able to talk about a patient that you've had some amazing success with?
I think this was the first patient who I ever dealt with in rehabilitation medicine. This was a young man who was very energetic and was into extreme rock climbing. And he had an accident. He fell down about 1,000 meters and was actually there hanging with his rope for about 10 hours, because that area was actually which they have designated that there will be no rescue taking place here, because that rock is very, very dangerous for even rescuers. So he thought that he's going to die, so he actually would try to kill himself by banging his head to the rock. And a helicopter actually tried to save him, and they thought he's already dead, but they brought him back, and he had about 12 cardiac arrests while with hypothermia because of low temperature. And when he came to us, he had a very severe brain injury, of course, and had a very high cervical cord injury, which meant he was not able to breathe on his own, was not able to talk and all that. But he slowly recovered, so he came off ventilator. So he decided to go to college, so he did a degree in biology, and then did his doctorate in molecular biology. And at the moment he is actually doing a work which may at some point probably will be considered for a Nobel Prize or something like that, because that is a very, very high level of molecular biology.
Thank you so much, Dr. Nazakat Hussain, for talking with me today.
Thank you for inviting me. Thank you.